Call the meeting to order,
Yep,
April 7th, 1 o'clock.
so it was 1 o'clock, pursuant to the governor's March 12th, 2020 order suspending certain provisions of the open meeting law, general law, chapter 38, section 18. This meeting is being held via remote participation to the greatest extent possible. Every effort is being made to ensure that any member of the public may access the meeting in real time via technological means. Agendas will be amended to show the link and participation code to access the meeting no sooner than 40 hours before. Recordings and/or draft proceedings of the meeting will be available on our website as soon as possible. And to add to that, I always send it to CTSB as well. So this is the Lenox Board of Health meeting, April 7th, 2021, 1:02 p.m.
Okay.
Okay, first item on the agenda
Is review of minutes
is review of
from,
minutes. If give me a second, I'll pull up the minutes.
okay, December 21st, 2/20.
I did send them out previously to the board.
Yep.
I move to approve.
I second.
All those in favor?
All those in
Aye.
favor, aye. Passes.
Okay,
Okay.
minutes are done. And I'll pull up the agenda so we can keep ourselves on track.
COVID-19 update next.
Hello.
I know.
Dr.
Afternoon,
Black.
no,
Sorry for my tardiness.
It's
Okay.
okay.
we're happy
Um,
to see you.
Yeah, I just launched you.
Yeah, so basically, of course, I printed out the wrong agenda. I printed out December. Anyway, COVID updates. I'll give
Yep.
everyone an update and pull up my notes and stuff. So we just got the recent BHS dashboard, and give me a second, I'll try to do a screen share on that as well. This came out today by Dr. Doyle, kind of the metrics, what's going on with the health system. With respect to the active cases in Lenox, we have 3 in the
Okay.
Maven system as of today, going back a week.
Okay.
We have an 18-year-old, an 8-year-old, and a 49-year-old.
Oh,
The percent positivity from last Thursday through today is at 2% exactly. The weekly metrics come to me on Wednesday evenings. And I think based on the positivity rate, I anticipate it getting below 2%, but I try not to like hang my hat on that because things can change over the next couple hours. You never know. There could be a big birthday party or something this afternoon or a cookout due to the weather. So Lenox is holding pretty well. I don't know if others have anything to add with that. The enforcement and complaints on sector specific guidance is significantly down. We're resuming our routine food service inspections. As things are settling out, we're kind of getting back into the groove. Let me stop the screen share here. We are working with Tanglewood because as part of the reopening, right now we're in phase 4, step 1, where certain things are being allowed, but there's certain things still aren't allowed. Things that aren't allowed yet are like large street festivals, road races, and of course parades. And so until we hear otherwise, we're stuck in phase 4, step 1. With that phase, outdoor performance venues are allowed under certain conditions. So we are working with Tanglewood as we speak, the BSO, to put together their comprehensive health and safety plans. We've already held a couple town hall virtual meetings to kind of go over certain things. So we're awaiting those comprehensive plans as we speak to how they're going to be able to contact trace, how they can respond to ticket holders, if we have to do contact tracing, how things are going to be spread out on the lawn, how they're going to be able to do the first food service operations. And they've hired an industrial hygienist company to help them prepare those plans. And we'll be working with them directly. But it looks like it's going to be a shortened season for Tanglewood. I think it's like a 6-week window sometime starting in July. And I think that's good timing because we're still getting doses trickling in. And President Biden announced, I think yesterday, that everyone from the general public should be eligible by April 19th. So, as we continue to vaccinate, and we're hoping, post Memorial Day, we start to open things up completely. But the DPH, they're not announcing anything soon with the next step of phase 4. My instinct tells me that as we start to get that equilibrium of vaccination percentages, things will start to open back up. But until that happens, we are in phase 4, step 1. As part of phase 4, step 1, they did announce a couple weeks ago that recreational camps will be able to be operational this summer. That includes day camps and overnight camps. It comes with a lot of restrictions. There's certain cohort sizes for day camps. They have to be masked. You can't have any visitors. Overnight camps, the cohort size can only be at 12. There's got to be PCR tests before they arrive. There's a PCR or a rapid test once they arrive. They have to go into quarantine. So they're creating somewhat of a bubble for the overnight camps, but there's still a lot of restrictions with respect to the cohorts. You can't mix one cohort with another. So, and that includes sleeping arrangements. So we're working with all the camps on that. Our largest camps are Camp Mackinac. I haven't heard from Belvoir, and there's a few others operating. And so we're working with that. We are getting a lot of inquiries on what a Memorial Day parade will look like. But as of today, that's not allowed under the current phase. And so it's important to let Chief Administrative Officer Chris Ketchen know about the Memorial Day parade, at least in Lee. But since he covers Lenox, he's aware of that now, that that's definitely not allowed. At least as of today. Could things change early May? Possibly. But as of today, that's what we're kind of sticking with.
Jim, how about Shakespeare? Has Shakespeare and Company reached out to you at all?
Not directly, but there's a lot of sector specific guidance out there, and whatever. I mean, these organizations aren't required to contact me, but most are, so we can review it.
Okay.
I work very closely with Norman Rockwell, the Mount, and a few others, and I'll put that in my to do. But some of these places have been operational on a limited basis, but outdoor performances will be able to be operational. And I did read something in the media about they are going to be doing some performances in Berkshire County. They just got to have their safety plans intact and be able to have that readily available. But I'll reach out to them as well to see what they're thinking. I have been in communication with them in the past, and I have reviewed certain standards from last fall. So I'm sure I'll be hearing from them relatively soon.
Jim, I have a question about Tanglewood. What will be the occupancy percentage that will be allowed? And I assume everyone will have to still wear masks.
Oh yeah, masking will be required. There'll be cohort distances. And I thought the outdoor performances was limited to what's like 5,000. It's pretty, if it's above 5,000, the state's got to approve the plan. If
that's shed and lawn, right? Shed and lawn total.
That's what they're thinking. And once I get the plan, the comprehensive plans, I'll share them with the board as we review that. But the outdoor performances, it's up to 5,000, which seems like significant.
Yeah.
That's what the shed holes.
But there's a lot of restrictions to that. And I know one has a hard time reconciling that an outdoor performance up to 5,000 can happen. Why can't we do a Memorial Day parade? You gotta remember, there's still a lot of social distancing and masking happening.
Yeah.
Where a parade, people are just lined up. It's impossible to social distance with a parade.
Right.
It's very specific guidance that's required. And one of the things they mentioned to me is how they're going to give out like an 8x8 piece of like rug or plastic with separation. So one cohort family can stay within their social distance circle and spread that out. And I think they really understand that there is going to be a lot of limitations. It can't just be carte blanche, like load up the lawn. There's got to be a lot of social distancing aspects that go with that. But the sector specific guidance will allow it as long as they adhere to that and comply. And I'm hoping by July, we're standing down the regional clinics. You know, vaccinations are readily available at the pharmacy and maybe PCO offices. I'm hoping by July, a lot of this stuff is behind us. Although I feel that COVID's not going to go away forever, I really feel that there's going to be a need for boosters and annual shots. You know, this may, and I would love to hear Dr. Blagg's perspective on this. This may, you know, I know there's a lot of studies going on how long the vaccination lasts. And I think until we get to herd immunity, this may not go away forever. I guess it may or may not. It'd be interesting to see. And that's why we're really investing in this possible nurse program, because there's going to be a need for that in the community as we go in perpetuity post COVID. Dr. Blake, do you have any thoughts about what you think?
I think the future is unclear at best. You know, we're still learning so much. We've just got our first studies out that show that immunity persists for at least 6 months after the Pfizer vaccine. That's good news. Could it be longer? Yes. Who knows? No one does yet. The role of variants coming in, and it's important to remember that increased spread is going to increase the number of variants that could occur. The effect of those, I think, remains also unclear. I think my own view of this is that vigilance is still required.
Yeah,
We've been humbled by this virus too many times already. We should learn the lesson.
Yeah, and I think masking is not going away anytime soon. I think
No.
what we're struggling with from the community perspective, and I had a long conversation with Norman Rockwell today, because they're getting a lot of populations that have already met the vaccination standards, and they're struggling. I don't say they're struggling, but like the perception is that people can put the mask below their nose and they're getting lax in their masking. And the only guidance that I saw at CDC, which was really guidance directed towards like Easter holiday, is that families within the same cohort that have been vaccinated, there's leniency there. But like the community at large still needs to understand that, like, you know, although you're fully vaccinated and you're post the 2+ weeks past the second vaccination, you still need to be masking.
Right.
You know, it's not going away. But so there's this public perception that like, oh, I'm vaccinated and I'm good to go now. And that's not necessarily accurate.
Yeah, I think it's important to recall that the end of the studies was to look for symptomatic disease, not whether or not someone became infected. Some of that data is now coming out and it looks pretty good, but still there's too much that we do not know, and only time and good studies will show us.
Totally agree. Yeah, so that's basically what I have for COVID updates. I don't know if there's anything that any of the board members want to tackle on COVID before I move on.
Well, I do that weekly meeting with the teachers, and they've been doing the testing, that group testing, and that's all working out very well. Actually, they did the student athletes at the high school last week. They did 135 of them, and they were all negative when they did the pool testing. So far, so good with being able to do pool testing and getting negative results.
So now, Diane, they're doing the students too routinely, right? Like the other
Yes.
schools are, because I know
Yes.
there was debate about whether or not Lenox was going to stick with the pool testing because
No,
of
they did. They joined that collaborative with the other school districts, and they do it. I think they do it. They may do it twice a week. I know they do it at least once a week. And they did it with all the student athletes 2 weeks ago, just before the season started, to make sure they were all set. I don't know how they're handling the athletes with it, but if they'll be in school, they'll be tested.
Yeah, that's great to hear. It's good. It's a good, you know, it's labor intensive, but it's a good surveillance tool.
Yeah.
To kind of get a feel for what's going on. I don't really have much more on COVID. It's really
They are.
we're still standing up the regional sites. The vaccines are trickling in. At some point they'll have to stand those down. You can't run those regional sites forever. So at
Yeah.
some point we'll see what the future looks on that. But we're just really trying to get a handle for these little micro bursts of outbreaks. We had a couple here and there in Lee. Lenox has been relatively quiet, and Stockbridge has been relatively quiet. But like, again, it seems like once we get our handle on things, another event comes up like spring break, right? So spring vacation's coming up with the schools, and it's like, and after that it's Memorial Day. It's like it just is like people just need to be diligent.
Yep.
It's always these episodes that just happen, over and over and over again, and we just got to get everyone vaccinated.
Yep.
I know moving on, I do have an update. So a few weeks ago, the Department of Public Health put out a request for response. It's an RFR, shared services, public health excellence funding opportunity. And what this is there's been this broader conversation in public health for quite some time, actually. And I think the pandemic has moved it quicker through the legislative cycle. Public health in Massachusetts is very unique. There's 351 cities and towns in the Commonwealth where there's no county government, there's no large regional systems. Tri-Town is one of the oldest regional health districts in the Commonwealth, being created in 1929, but there's only 4 or 5 districts in the state, true legit districts that have a system of sharing resources. And they're trying to also raise the benchmark of minimum qualifications in public health departments, because the challenge in Massachusetts is it's all taxpayer funded, which creates a lot of inequities. So if you're in a smaller town that doesn't have a lot of resources, it's impossible to put together a comprehensive health department because the taxpayers can't afford that. And so there's been a lot of inequities, and in responding to the pandemic, Tri-Town has responded better than some, but there's still challenges there. We had been working on a comprehensive public health nurse program, as you may know. And then when the pandemic hit, we were caught in a very challenging perspective. And so they put out a significant amount of funding. It's a 13-year grant up to $300,000 a year, fully funded by the DPH. So Tri-Town was a lead applicant, and we put in a comprehensive application to create a Southern Berkshire public health nursing program with Tri-Town alongside a handful of other smaller South County towns. And so if we get the funding, we will have the capabilities of hiring multiple public health nurses full-time with benefits, all covered by this funding for many years to come, where we would be able to have full-time nurses meeting our needs and helping out some of the smaller towns. That's been submitted. And once we hear more, we'll be really excited to start recruiting full-time nurses to really meet the needs of the Tri-Town district and helping out some of the smaller towns that have no access to 0 nurses right now. So, and with the future, not knowing the future of COVID, there's going to be a need for a comprehensive public health nursing program. So that's really exciting things to think about. And I'll let you know if we get funded, and I feel really confident in our application that we submitted. It's a very innovative way of creating a Southern Berkshire regional focused system that we don't currently have.
When might we know that, Jim? Any idea?
Next week or so. It's a very short turnaround. They're talking about executing contracts by May 1st.
Wow.
And so so the proposal that we submitted is it's 2 full-time nurses. One would be the nurse leader, and one would be another nurse, building up our programs, our own flu programs, helping with COVID. We could have our own clinics here in the future, doing our homebound seniors. Right now, a lot of that's not happening because there's not enough nursing resources in the county. And, we had contracted with Porchlight for so long for bare bones minimum, and then they went out of business when the pandemic started. So while we're contracting out for a public health nurse and they're doing a good job, it's nowhere near enough capacity to really meet the needs of the community. Because when we start to talk about comprehensive public health nursing, we're not just talking about a flu clinic. We're not just talking about a MAVEN investigation. We're talking home wellness checks, helping us with camp inspections, working with homebound seniors, working with veterans. There's so much more to be had that our community members deserve for comprehensive nursing. This gives us that opportunity because most municipalities cannot afford a licensed full-time public health nurse to do comprehensive services. And what we're trying to do is start moving away from the archaic public health delivery system to more of an innovative, 21st century comprehensive programming. Tri-Town delivers a comprehensive public health program minus the nurse program. So that is the one gap that we've had for quite some time. With or without this funding, we were moving down that direction anyway, post-pandemic. We've already secured funding from the town to start looking at a public health nurse, but then this RFR opportunity came up, and of course, we're going to tackle that. We would rather go after that kind of funding than ask the town for that.
Right.
But no, we'll always want to budget something though, because we want to move towards sustainability. So if there's like a medical refrigerator, we need to buy vaccines, that funding won't cover that. So we need to have some funding set aside through Tri-Town to make sure we can continue that comprehensive funding process. And that's a good segue going into the budget. The budget was approved by the boards back in January. They've already been submitted to the finance committees. I haven't heard any feedback, but no news is good news for us. And
Yeah.
I feel really confident in our budget application for the three towns, because what we're doing is we're eliminating the warrant line items for the old VNA systems, and we've merged them all into the Tri-Town. So when we look at the bottom line, what's going to cost the taxpayers, it's a minimal increase, by the way. It's minimal. And so we're in pretty good shape. And if we could start to build a comprehensive public health nursing program, we'll have a fully well-rounded public health delivery system for the district.
And she'll end up being self-sufficient in just what you can get reimbursement from flu clinics and things like that too. So there'll be an inflow of money, which will help offset things.
Yep. I guess I do want to go. I do have one more update with respect to COVID. So we've been working with the Lee, Lenox, and Stockbridge housing authorities, and we've partnered with CHP, and they've went on site to do all three housing authorities. Lenox has just finished their second round of shots.
Yesterday.
Lee and Stockbridge will be tomorrow, so that'll wrap up the senior housing. And so, I want to thank CHP for stepping up to the plate, helping us coordinate that to get shots in arms. I don't have anything else. If people have specific questions for me, I'll be happy to answer them.
I do. Of course I do. The neighbors in the Tucker's Fairview Street area, that one house that always keeps popping up. I was approached yesterday by one of the neighbors with a great deal of curiosity. She had heard that you guys had gone in the house again,
Not in the house,
just around the house.
around the house, and we've
Okay.
already contacted the owners and their legal counsel. It's
Okay.
really it's overgrowth in the lawn, and there are no codes or regulations that
I know.
regulate that. What we try to do is we try to work with them just to try to keep the peace in the neighborhood. And Jason did deal with that, and I'll circle
Okay.
back with them. And we did let the legal counsel know. The house was pretty much emptied out a couple of years ago, and but they got to try their best to maintain, because those are very tight lots.
Very tight.
And so the neighbor, I think behind there, was complaining because their fence was falling over, and we did let their attorney know, and
Okay.
we'll see how that shakes out.
I hear from them all the time, Jim. It was very nice. They were very happy that you had pursued that. That's all I wanted to say is hope springs eternal in that neighborhood.
Well, I think with the snow melt, we're gonna start to see more housing complaints, which we're already
Yeah.
seeing.
What happens if they don't follow through on it?
Oh, they go to
Nothing
court.
we can do, is there?
It's very, lawn overgrowth is not an easy thing to enforce.
Mhm.
What I try to do and know, if there's not a garbage or like rubbish issue,
Mm.
what I'll do is I'll write a letter and send it out to really try to motivate them a little bit, to kind of
Mhm.
push them along. The fence issue could probably be enforceable by the building inspector. You know, if you have a stockade fence and it's leaning over on someone else's property, that could probably be a zoning issue. But it's not like falling on the neighbor. It's sort of like just leaning a little bit, but
Yeah.
we need to try to maintain that. We always try to work with people just to satisfy the needs, but that's a property that we've been dealing with for years, and
Yeah.
it was condemned at one point, and they cleaned it up through their legal counsel. It's boarded up, it's sealed, there's no broken windows. It's just, there's a lot of tight lots in that neighborhood, and you can be 5 lots over and do something, and then the neighbor on the opposite side will know. So,
Yeah.
Yep.
so it's one of those things we're keeping an eye on, and if things do get triggered under the housing code, we'll cite them as warranted.
Okay.
Mhm.
I had a question for you. I had somebody 2 days ago call with this, and what do we do, or what recourse do we have? So this woman has a neighbor who lives alone in her own house, lives on Housatonic Street, and they found her out wandering across the street in someone else's property. And that neighbor had approached her, and the woman said she didn't know where she was, and she's got a little bit of Alzheimer's. So they brought her back across the street. They called 911, and the ambulance came, took her. She was later discharged, but now the neighbor says nobody is still looking in on her. Who
Yeah.
eventually gets in on that if you find it an unsafe situation that the woman is home alone? Because the neighbor said, there's gas stove, gas heat. She doesn't know where she is half the time. I said, is it a mess? Is it a hoarding mess? She said, no, but I just fear. She said, and I don't want to be the person that's always being responsible for her. She doesn't want to wear that guilt. And I said, I'm not too sure. I think 911 was the proper call then, but I don't know if you keep on calling 911 all the time.
There's no family, Diane?
There's family in Pittsfield, but they don't tend to bother with her.
Oh, that's awful.
It's
Yeah, I
terrible.
mean, if there's a family member, they could always call Elder Protective Services to
Okay.
see if they can do an intake and then
Oh,
refer
okay.
them to the appropriate services.
Okay.
These are complex issues. We, in many cases, we'll get a referral, and then I'll try to link up with social service agencies to see if they can step up and help. Our jurisdictional authority is sanitary code conditions,
Mhm.
and we can't necessarily
Mm.
always project how well people are living in their homes under certain conditions. And a lot of times, there's no housing, there's a lack of emergency housing and senior housing. And if there's family members, they should, if they have, someone can always call me, and I can always link them up to Elder Protective Services. But that's
Now-
really,
No,
if
we're
a
not talking
primary
about.
care doctor or something like that, they should be notified. But like, there's a lot of HIPAA stuff that's involved here, which I
Yeah.
want to be careful what I say in a public meeting. But
So if the woman calls me again, I should tell her she's got the phone number of the daughter up in Pittsfield. Just call the daughter. But if the daughter doesn't respond, could this neighbor then call Protective Services on her own, just as a worried neighbor, like a good Samaritan, or no? I don't know what to say to her.
possibly, I would have them call me, and then
Okay.
let me see what I can do. And
Okay.
what I can do is I can put a request into Elder Protective. But what ends up happening is they'll try to contact the individual, but if the individual refuses help, that it
That
ends.
ends
It
That
ends.
ends. Yeah.
But if
Okay.
people are concerned, call me, and I can redirect them to the proper places.
Okay. Thank you.
You're welcome.
That's it for me. What do you think, guys? Anything?
That's it for me, nothing for me.
Okay,
Do we have a tri-town meeting coming up at all?
not
June?
yet, but we'll try to get something going.
So
So-
next quarterly meeting will be towards the end of June or whatever, once school's
Yeah.
out and everything.
Yeah, Yeah, we'll wanna revisit our district tobacco regulations at some point,
Oh,
just
I
to
wrote that
clean
down
some
too.
stuff up on
Yeah.
that. But outside of that, we anticipate a very busy summer, very
Okay.
busy. And I think with camps and hopefully full reopening, we anticipate a very busy summer. But outside of that, I don't have much to add, but I'll entertain a motion to adjourn whenever you're ready.
So moved to adjourn.
Second. All those in favor? Aye.
Aye.
Thank you for
Aye.
your time today.
Thank you.
guys.
Thank you.
Have a good day.
Bye
You
now.
too.
Bye.